So, good day once again to my students in pharmacology. Last video tutorial we have discussed the introduction, the first part, okay, of the introduction to pharmacology, and we have discussed the different names of the drugs, a bit of history of the drugs, and also discuss pharmacodynamics and pharmacokinetics. And we're moving on to the next topic, which is about half-life, onset, peak, and duration of the drug. But before that, let's have a recap of what we have initially discussed, or the discussion we had on the previous video tutorial. Okay, so when we say pharmacodynamics is the study of the interactions between the chemical components of a living system and the foreign chemicals. Okay, so when we're saying living system, it is the sa essence or sa context of pharmacology, we're talking about the human, okay, the person who had the drug, okay, who have taken the drug, to whom the drug is administered, okay, and the foreign chemicals are the drugs, okay, and those particles, those chemicals that enter the systems, the different systems of the body. Okay, so that is the definition of the simpler definition or meaning of pharmacodynamics, comparing to the first we had on our previous video tutorial or video lecture. Okay, so again, pharmacodynamics is a study of the interaction between the chemical components of the living system and the foreign chemicals. So chemical components of the living system refers to the chemicals inside our bodies. Okay, then the foreign chemicals, in the context of pharmacology, we are talking about the drugs, the drug particles, drug chemicals. Okay, so as we have said earlier, drugs usually work in one of four ways, and it is presented here in our slide. This is first to replace or act as substitutes for missing chemicals. For example, it's either you have a missing chemical or you lack a chemical inside the body that's important in our process or processes, or you have deficiency of a chemical. So it's either lacking or deficient. Okay. Then second is to increase or stimulate certain cellular activities. Okay, to increase, to stimulate, to hasten the chemical processes or cellular activities in our body. So that's second work of drugs. Third is to depress or slow down the cellular activities. So ano siya, parang counterpart naman siya or kabaliktaran naman siya ng number 2. Kung yung isang work ng drug is mapabilis yung cellular activity o yung chemical processes sa katawan, yung isa naman pwedeng pabagalin niya. No? So then fourth, to interfere with the functioning of foreign cells such as invading microorganisms or neoplasms. So this number 4 work is working naman against, okay, the functions, the cellular activities of foreign cells. Okay, yung number 2 and 3 we're talking about normal cells, normal body cells. Then number 4 is foreign cells. Sabi dito, no? These drugs that act in this way are called chemotherapeutic agents. So when we say chemotherapeutic agents, we're not only talking about cancer drugs. We're also talking about, example is anti-infective drugs, anti-infective drugs. And drugs can act in several different ways to achieve these results. Okay, so that is pharmacodynamics. Okay, again, it's the study of the relationship or the interaction between the chemical components of the living system, that is us, the human person, or a person who have taken the drug, to whom the drug is administered, and the foreign chemicals, including the drugs, and whichever systems are affected. Then, just to recap again, there are four ways a drug can work. One is to replace or act as substitute for missing chemicals. Number two is to increase or stimulate certain cellular activities. Number three, kabaliktaran po ng number two, is to depress or slow cellular activities. Then number four, to interfere with the functioning of foreign cells, including neoplasms or your cancer cells, um, and microorganisms or your infections. Okay, your the organisms that can cause infections in our body. Yeah. So that is pharmacodynamics. Okay, so have a recap. Then next is pharmacokinetics naman po. Okay, pharmacokinetics. Pharmacokinetics is the study of how the body deals with the drug. Okay, especially when the drug enters your body. Okay, what does the body do to the drug? Okay, how the body deals with the drug. Okay, what are the actions being done by the body towards the drug. Okay, yan po yung pharmacokinetics. So that's the difference between pharmacodynamics and pharmacokinetics. Pharmacodynamics is the how the drug deals with the body. Okay? Yung pharmacokinetics naman, how the body deals with the drug. Okay? So, to make it simple, yung difference na yan. So, sa pharmacokinetics, the concentration of a drug in the body is determined by the balance of absorption, distribution, metabolism, and excretion. Yung ADME na sinasabi natin earlier. Okay? Tinanggal lang natin yung una dito na liberation. Pero yung four phases talaga or four processes talaga na kasama sa pharmacokinetics yung apat. I mean, is absorption, distribution, metabolism, and excretion. Then, in determining the amount, the route, and appropriate timing of the drug dose, the pharmacokinetics of the drug has to be considered. Ibig sabihin yung apat na yun. So, ibig sabihin, para malaman mo yung drug dose, malaman mo yung amount, malaman mo yung route, o yung way ng administration is you need to know the pharmacokinetics of the drug. You need to know the absorption, the distribution, metabolism, and excretion. And on the later video tutorial, as we go through the study of pharmacology, yan yung magiging presentation ng ating mga lectures po. Especially when we are going to we are going to study about the different drugs na, different drug classifications. Okay, ADME yung presentation natin, what is the absorption of the drug, what is the distribution of the drug, what is the metabolism, what is the excretion, sorry. So, yun po yung presentation ng ating lectures. Then, in relation to pharmacokinetics, let me just insert this topic because it affects the absorption, the distribution, and the excretion na rin. So, we have protein binding, blood-brain barrier, and placenta and breast milk. So, unahin natin sa blood-brain barrier. Okay? So, sa blood-brain barrier, in your anatomy, you know that blood-brain barrier is a protective system of cellular activity that keeps many things away from the CNS. Okay? It's a protection, okay, in the brain. And because of its protective mechanism, protective system, the brain is difficult to be affected. Okay, even the drugs actually cannot penetrate the blood-brain barrier. Okay, We have mentioned earlier that there are lipid soluble or fat soluble drugs. There are also soluble drugs. Okay, lipid soluble and lipid soluble drugs. These drugs, which are highly lipid soluble, are more likely to pass through the blood brain barrier and reach the CNS or reach the central nervous system. And these drugs that are not lipid soluble are not able to pass the blood brain barrier naman. Okay? So those are the two. One is highly lipid soluble drug and the other one is not highly or not lipid soluble drugs. Those which are not lipid soluble are not able to pass the blood brain barrier. But what this is very important because almost all of antibiotics, almost all of anti-infectives are considered to be not lipid soluble. So, sir, paano ngayon? Ibig sabihin nun, kapag nagkaroon ng infection sa utak, halimbawa, because of the blood-brain barrier, hindi po makaka-penetrate yung antibiotics. Okay, gets? Again, antibiotics, almost all the antibiotics are not lipid soluble and cannot pass or cannot cross the blood-brain barrier. Okay? Kasi nga, ang nakaka-pass through lang is yung mga highly lipid soluble. Sir, paano kapag nagkaroon ng infection sa brain, halimbawa sa CNS, no? Paano din magiging effective yung penetration ng ng antibiotics which are not highly lipid soluble. Kailangan, ironically, kailangan mo ng masira, no, ng infection ng microorganism, ng pathogenic organism, yung blood-brain barrier para makapasok po yung para makapasok yung less lipid soluble na mga antibiotics. Okay? So, meaning effective antibiotic treatment can only occur when the infection is severe enough, okay, to alter the blood-brain barrier and allow the antibiotics to cross. Okay? So, kailangan mo nang masira yung blood-brain barrier ng infection para makapenetrate din yung antibiotics. Okay? Siyempre, yun naman yung magiging event. So, ang nakakasira doon talaga infections. Tapos, saka makapasok din yung antibiotics. Okay? So, that is the blood-brain barrier. And next we have is the placenta and breast milk. Okay? Sa placenta and breast milk, many drugs readily pass through the placenta. So, we're talking about a pregnant woman and also a nursing or a breast feeding mother. Okay? Ibig sabihin, nagpapa-breastfeed. Okay? So, many drugs readily pass through the placenta and affect the developing fetus in pregnant women. And as we have stated earlier, it is best not to, or if not mentioned, because we're going to study this later pa. Okay? As studied, it is best not to administer any drugs to pregnant women because of the possible risk to the fetus. And if ever the woman needs to take in drugs, syempre you need a prescriber, a physician, person with specialization on that. For example, your OB, and many other drugs should be evident na the benefits should outweigh the risk, especially to the growing fetus. Okay? Makonsider mo siya dapat at least safe sa buntis, safe sa growing fetus. Okay? Not really on the mother, but on the growing fetus. And many other drugs also are secreted in the breast milk, so that's how a newborn, a neonate can be affected of the potential what's this? Potential effects of the drug. Okay, so it is important that the nurse or you, the doctor, have what's this? A very good interview, a very good history taking, a very good assessment on these types of clients, these types of patients. Yung mga pregnant, um, yung mga nursing moms or yung nagpapa-breastfeed nga. Or, syempre, minsan hindi mo pa nahalata na buntis pag early stages of the pregnancy, the mother or the partner should inform no, the prescriber, the physician na buntis siya or nagpapa-breastfeed siya. Okay, because again, it has an effect on some drugs, okay, if not most, will have okay, a very great impact on pregnancy and on breastfeeding po. Yan, then we proceed to our next topic na. Okay, so we have half-life. Okay, this is the measure of the time required for elimination. Okay, ibig sabihin elimination ng drug. Okay, remember in ADME, di ba, yung pang-apat is excretion or elimination. So, half-life refers to the measure of the time required for the drug to be eliminated from the body. Okay? At the definition, amount of time required for 50% of the drug to be eliminated from the body. Kaya po tinawag na half-life. Okay? The half-life is determined by the individual's ability to metabolize and excrete a particular drug at approximately the same rate. So, ibig sabihin nito, no? Paano ba natin ita-translate to? Halimbawa, ang isang gamot ay 10 milligrams. Okay? At ang kanyang half-life ay every 2 hours. Ibig pong sabihin, once, halimbawa, no, na-administer na sa katawan ng tao yung gamot, okay, every 2 hours, 50% of that 10 milligram drug is eliminated. So 10 milligrams after 2 hours, let's say 8 o'clock, after 2 hours, 10 o'clock, 5 milligrams na lang siya. After 2 hours, 2.5 milligrams na lang siya. Okay, after 2 hours, 1.25 milligrams na lang siya. Until, let's say, clinically, ano na siya, evident po na eliminated na. Okay, so there are some drugs that are eliminated fully, okay, days, to certain, let's say mga 5 days, 4 days. Importante ito because of the third bullet. Sabi dyan, the half-life is determined by the individual's ability to metabolize and excrete a particular drug at approximately the same rate. So, when the half-life is also known from a certain drug, it is important in determining the dosage. It is important because you can already determine the dosages. Ibig sabihin, the dosage of the drug, ilang dose dapat ang i-take ng isang tao, and the duration. Okay? Gaano katagal ba yung effect nung gamot na yon sa katawan ng tao? Okay, that's duration. And frequency. Gaano kadalas po na iti-take ngayon ng tao yung gamot because of the half-life para ma-maintain yung effectiveness. Okay? So, again, when the half-life of a certain drug is known, the dosages, the duration, and frequency can be calculated. Ibig sabihin, ulitin ko lang, pag alam mo yung half-life, pag alam mo kung tuwing kailan na-eliminate ang 50% ng isang buong gamot, ay malalaman mo kung ano dapat ang dosage ng gamot para sa pasyente ito, para sa tao. Alam mo ang duration ng gamot, gaano katagal yung epekto niya sa katawan ng tao, at gaano kadalas niya dapat i-take yung gamot. Okay? So, the other topics after half-life is related to this also. Okay, so since we're talking about the third bullet is metabolism and excretion, on the part of the nurse, the part of the doctor or the prescriber, it is also important to review the renal and hepatic functions of that person. Ibig sabihin, aralin mo yung status ng kanyang kidneys, aralin mo yung status ng kanyang liver. Because there are certain drugs that which are um, who has longer half-life. Okay? Longer half-life. So, ibig sabihin yan, halimbawa, ang isang gamot, 12 hours siya, 12 hours ang kanyang half-life. Ininom mo siya ngayon, halimbawa 500 milligrams. So, after 12 hours pa, makakalahati yun. So, matagal yun, ma-eliminate. Okay? Ang mangyayari dyan, pwede is the uh, what's this? The longer the half-life, okay, the lesser the frequency. Kasi pag kung alam mong mahaba ang kanyang half-life at iniksian mo o pinadalas mo, okay, yung pag-take ng gamot, ibig sabihin, ginawa mo siyang mas frequent, the person can be at risk for toxicity. Kasi naiipon yung gamot, half ng half, tapos nagiging compounded na sa loob ng katawan. Tig 50% lang yung na-eliminate. Mas marami na yung pumapasok sa katawan kaysa sa na-eliminate. So, the person might be at risk of or for toxicity. Okay, kaya napaka-importante po aralin ng half-life. So, siguro, yung 12 hours na yan, na half-life ng isang gamot, is pwedeng once a day lang yan, or pwedeng twice a day lang yan, to maintain the effectiveness. So, it depends. Meron din mga gamot po no, na matagal talaga ang half-life. Minsan, kaya nga ginagawang once a day lang. Yung iba, ginagawang twice a day lang. Okay? So, that is half-life. The measure of the time required for elimination, the amount of time required for 50% of the drug to be eliminated, okay, from the body. Again, so it's important to know the half-life of the drug because you will be able to know the dosage of the drug to be administered, the duration of the drug, gaano katagal ang kanyang bisa, and also gaano katagal siya sa loob ng katawan, and also the frequency, gaano kadalas mo i-administer yung gamot. Okay? And yung half-life. Then next, we have onset of the drug. Ano naman yung onset? Sabi sa ating slide, sa ating presentation, this is when the concentration of a drug at the site of action is sufficient to start a pharmacologic action or response. Ibig sabihin, this is the concentration, kumbaga in simpler terms, this is the amount of drug needed to initiate, okay, pharmacologic actions, pharmacologic response, therapeutic action. Ibig sabihin, kung mas mababa sa required concentration ang nasa katawan ng tao na binigyan ng gamot, wala pong mangyaring onset, walang mangyaring therapeutic action, walang mangyaring pharmacologic action or response. Okay? So, dapat kumbaga sakto lang, no, nasa normal drug level sa dugo para magkaroon ng therapeutic response, magkaroon ng pharmacologic action. Okay? And factors affecting the onset, okay, just to clear, no, yung onset po, ulitin ko ha, sabi dyan is pag nag-take effect na yung gamot. Okay, pag meron ng pharmacologic response, hindi po sa pag-inom, hindi po sa pag-administer, binibilang yung onset. Kung kailan nagsimula yung action ng drug. Okay, factors affecting the onset is the route of administration, absorption rate, distribution, and receptor binding. So, alas pareho yung dalawa na route and absorption rate tsaka distribution and receptor binding. So, yung route and absorption rate muna tayo. Okay? From our previous video lecture, we have stated that different routes give different rate for absorption also. The faster the absorption, there are some routes which gives or provides faster absorption rate. So kung mas mabilis ang absorption ng gamot sa katawan, mas mabilis yung onset. Mas mabagal yung absorption sa katawan, mas mabagal yung onset. Mas matagal yung effect. Mas matagal magsimula yung effect ng gamot. Okay? Mas matagal mo maaasahan yung yung gusto mong indication ng gamot, yung action, yung gusto mong mangyari sa pasyente, mas matagal. Kunyari, gusto mong bumaba kanya agad ang kanyang lagnat, mas matagal yun kasi mas matagal ang kanyang route, mas matagal ang kanyang absorption rate. Okay? Distribution and receptor binding naman. So, we have mentioned earlier that some drugs are protein bound. Okay? At ang sabi natin, pag ang gamot ay protein bound, sila yung mga drug chemicals na walang therapeutic effect, walang therapeutic response, walang pharmacologic activity. So, mas matagal yung onset kapag bound sila sa protein. On the other hand, drug particles which are unbound, they are free, ibig sabihin, they are in the bloodstream, no? To make it easier to understand. So those drugs which are in the bloodstream will cause therapeutic effects, pharmacologic activities. So, magkakaroon ng onset yun, magkakaroon ng therapeutic response, magkakaroon ng pharmacologic activity. Okay, mas mabilis yun. Pag unbound drugs compared to the bound drugs. Okay? So, increasing the dose here, hastens the onset by shortening the time required. So, ang mangyayari, pag ganun po, ibig sabihin, pag tinaasan mo ang dosage, halimbawa, to make it clear, halimbawa, ang gamot, regularly, tinitake mo siya ng 500 milligrams. Okay, in a regular frequency, in a regular dosage, I should say. Pero para mas mabilis mag-take effect, mas mabilis yung onset, the prescriber may increase the dosage. Okay? To hasten the onset. Para mas mabilis mag-take effect, mas mabilis ang onset. So, from 500 milligrams, gagawin niyang 750 milligrams halimbawa lang. Okay? Mas mabilis yung onset niya. And this is related to our next slide. Critical concentration and loading dose. So, meron tayong dalawang terms in relation to onset. After a drug is administered, the molecules first must be absorbed into the body, as we have discussed earlier. Then they make their way to the reactive tissues or find their way to the receptor sites. Then, if a drug is going to work properly on these tissues, on these reactive tissues, thereby, it will produce a therapeutic effect. Okay? And sabi natin kanina, there is a sufficient amount dapat or sufficient concentration of the drug to take effect in the body. So, yung concentration na ito, yung tinatawag natin na critical concentration. Itong nasa una. Okay? Critical concentration. That's the amount of drug that is needed to cause a therapeutic effect. Okay? Yan yung critical concentration. Ano naman yung loading dose? Okay? Ulitin ko lang, parang na-explain ko na rin kanina. Loading dose, some drugs may take a prolonged period to take effect or to reach its critical concentration. In relation to the first term that I have discussed. So, kung mas matagal ang critical concentration, mas matagal ang onset. Kaya mas matagal ang therapeutic effect. If their effects are needed quickly, a loading dose is recommended. Okay? A loading dose is recommended. So, pag sinabi mong loading dose, it will require a higher dose than that usually of the treatment. Ngayon, yan yung sinasabi ko kanina na kung regularly ang ang dosage ng isang gamot ay 500 milligrams tapos ginawang 750 milligrams para mas mabilis siyang mag-take effect. Ngayon, assist the succeeding doses, okay, the succeeding doses of that loading dose, from that loading dose, dapat ano na po, maintain na po yung recommended dosing niya. Ibig sabihin, nung umpisa nag-loading dose ka ng 750 milligrams, halimbawa lang na 3 times a day yung gamot or 4 times a day. Yung succeeding doses, ibalik mo siya sa regular recommended or the recommended dosing. Okay? Kung yung gamot ay 500 milligrams, nag-loading dose ka, ginawa mong 750 milligrams, let's say, ginawa mong 1 gram, dapat yung susunod po na doses ay regular. So, first is 750 milligrams or 1,000 milligrams. Tapos pag next na ay 500 ulit, next 500 ulit, next 500 ulit. Okay, hindi pwedeng maintain mo na yung loading dose pare-pareho na nag-times 2 ka o nagdagdag ka. Hindi pwede. Okay, so that is critical concentration and loading dose. Okay, I hope that's clear. And punta na, let's proceed naman sa peak action. Okay, peak action is the time at which a drug reaches its highest concentration in the receptor sites, inducing the maximal pharmacologic response. So, ibig sabihin yan, that's a time that you are, the drug is most effective kasi dyan yung highest concentration niya. Okay? That's at least na-meet niya yung kanyang critical concentration or even the maximum critical concentration. Okay? So, dyan yung usually sinasabi ng mga, dyan na mismo usually sinasabi ng mga pasyente o tao yung gumagana na siya. Yung gamot, nawala na yung manifestation, nawala na yung problem na iniinda. Okay? So, that is peak action. The time at which the drug reaches its highest concentration in those reactive tissues, in those receptor sites. Okay? Then next is duration. Remember, kahit na umabot siya sa peak, there are times na mag-wear off din yan kasi meron siyang certain duration. Hindi pwedeng nandun at nandun lang nakakabit sa, kumbaga nakakabit sa receptor sites yung gamot. It will wear off also. Okay? So, duration is how long the drug has its pharmacologic effect. Okay? So, hindi po sa oras na pag-inom hanggang sa oras na na-eliminate mo yung gamot. Okay? Duration is how long the drug has its pharmacologic effect. Okay? So, yun yung ibig sabihin ng duration. So, as you can see here pala in our graph, T0 to T1 is the onset. Yan. Then, T0 to T2, okay, from the moment it is already, the onset has taken place, hanggang dun sa maximum pharmacologic action niya. That's your peak. And mula sa onset hanggang sa wala ng bisa ng gamot, okay, that's the duration. Okay. So when you say also duration, there are certain drugs or drug level which does not even meet the minimum effective concentration, which does not even meet the critical concentration. Ibig sabihin, napakababa pumapasok sa katawan ng tao dun sa versus the desired critical concentration. So, mangyayari doon, dahil minimal ang pumasok sa katawan, walang therapeutic or walang pharmacologic effect na mangyayari. Okay, halimbawa 500 milligrams. Pero ang ginawa ng tao, ininom niya 250 milligrams lang. So, hindi magkakaroon ng pharmacologic effect yun. Okay? On the other hand naman, Kapag naman sobra-sobra yung concentration ng gamot sa loob ng katawan, it's either naipon, no? Ginawa mong napaka-frequent, kasi sinabi ng doktor, once a day lang, ginawa mong thrice a day for several days. No? What will happen naman is the peak level will exceed. No? So, ang epekto naman nito is toxicity. Okay? So, ibig sabihin, toxic effects, harmful effects can happen in the body. So, when a drug is circulating in the blood, a blood sample may be withdrawn. Ibig sabihin ng withdrawn is pwede ka kumuha ng sample. O kumuha ka ng dugo, ginagawa yun sa ibang bansa. And they will determine the level of the drug present in the blood po. Yun yung tinatawag na drug blood level. Sorry, drug blood level. And so this is to determine the amount of drug or the level of drug in the person's blood. Okay, if it's too high, it can lead to toxicity, and if it's too low, it will not be effective. There will be no therapeutic effect. So dapat normal lang, sapat lang dapat. And if it's too low, pwede naman na mag-modify ng treatment regimen yung prescriber. Okay, baka kailangan i-increase yung frequency, increase yung dosage ng gamot. Okay, so that is your drug blood level, and in relation to duration. So let's just have a recap. Okay, we have half-life. This is the measure of the time required for elimination. 50% of the drug is eliminated depending on the time of half-life. And this is important to determine the drug's frequency, duration, and dosage for administration. Okay, and it's important to review the liver and the renal status of the patient. We have the onset. As we have said, this is the time when the pharmacologic effect of a drug starts. Okay? And we have critical concentration and the loading dose. Pag sinabi mo critical concentration, this is the sufficient concentration level of the drug, okay, to take effect or take the therapeutic effect. Okay, pag sinabi natin loading dose, this is what's this increasing, no? The concentration or increasing the dosage, okay, of the drug to be administered to to meet the critical concentration faster or earlier. Excuse me. Then we have onset, the peak action. This is the time when the drug reaches its maximum concentration and the maximum pharmacologic response. Then last is duration. How long the drug has its pharmacologic effect. Okay? So yan po yung topic natin for this video lecture. Okay? So thank you for being attentive. Okay? You can watch this anytime in our LMS. Okay? But remember, this should not be downloaded, not to be shared to others. Okay? So thank you for watching. And any reactions, additional insights, queries, just ask it in our LMS. Okay? Thank you.